His hit song Tangwa Kidala Fest, which was released in 1988. Part of the lyrics, they say, Ambuya, Msafene Nyota, Makumbaru Mvua. This is a classic example of an institution that is crying every day for support when there are private players surrounding it, opportunities left, right, and center, going to the private sector. So you cannot come to the committee and say, we are restricted by policy, we are restricted by what? You are the ones who should actually have a workshop and say we are going to hire even NGOs like Legal Resources Foundation to come and say, these are the statutory instruments that you can propose to be changed. These are the laws that you can propose to be changed. And then present to the Ministry of Health, present to Parliament so that you adapt, especially with regards to independence, to self-sustainability. You cannot continue to give this excuse. Where you can see that around you here, people are selling, taking patients from you, which you should be having. In fact, one of the biggest challenges we have in Zimbabwe, we've got what we call medical tourism. A lot of Zimbabweans are going to South Africa. A lot of Zimbabweans are going to India, are going to Zambia, to Mozambique, to Botswana for medical healthcare services, which Mpilo Hospital, which Pari Hospital can provide, all could provide. So you are just watching, you are complaining, there is no money, we've been waiting for 2 years. When you can actually procure those things, and if you say are being stopped by policy, then Christ said, let me quote him, the law was made, man was not made for the law, but the law was made for what? So you cannot complain for 15 years while services are not being provided. Machines are dead for 6 years. Patients are dying. So you have to think outside the box. You are the ones who should recommend changes. Because the feedback for changes cannot come from Parliament. It comes from you on the ground. We are seeing what's happening. The laws that were put by Ian Smith, you want to implement them today. You are the ones who should recommend. This is now outdated. Please, Parliament, help us. Ministry, help us. So that we can adapt. I also spoke about benchmarking visits. There is still no harm from you without the ministry going out. NGOs are there that provide the right to healthcare support system. They can take you to Zambia, they can take you to Botswana, to South Africa, to see what other public hospitals are doing. And then you do a position paper to Parliament, to the ministry, and say, these are the changes we are proposing. We've seen it happening in Lusaka, we are seeing it happening in Gaborone, we are seeing it happening in Cape Town. We want that to happen in Zimbabwe because we are losing a lot of money, but more important, we are losing a lot of lives. I heard that 80% people are dying. 80%. And you think that's normal? Hospitals are supposed to bring life, not facilitate death. Kuti hai makwenda kudenga yaine kupanda furahi yenyu kupanda. You might as well expand your mortuary. So what I'm saying is, don't accept this. You have to reject and say our responsibility is to protect Section 76 of the National Constitution. I quote, every citizen has the right to health. A right remains abstract until those given the responsibility to implement it come up with new ideas. Because what we see here is lack of innovation. Lack of innovation. You just accept the status quo. When around you, some of us who travel a lot, we see that public hospitals are not operating using this model. So you can recommend to the committee, you can recommend to the ministry to say, we have done a report. There are NGOs. If you don't know the NGOs, just do a mapping. There are NGOs that deal with the right to health. They can say the medical, the CEO, the CMO, the what, we are going to pay for you for 2 weeks to go to 5 countries benchmarking this. And they have the money. And you can go and learn. But don't accept what is there. Because for patients who are dying here, you are the ones who are accountable for them. Maybe you're assuming you're going to heaven. You will find that the heaven, you have got a list of people waiting for you. You could have saved us just by being innovative as a leader. Related to that, let's talk about legacy. If you are given a responsibility, like to be a chief medical officer, chief financial officer, you must say, after I finished my term of office, this is how I shifted the direction of this institution. Don't just accept what you found, the inefficiencies, that machines can last for 5 years without working. You just accept that, you just accept that. You can say, when I became the what, ndindakaunza my machines, ndindakachinja my units, ndindakaita life expectancy rate Zimbabwe isimuke. So I'm challenging you guys, don't relax. And some of you, I know you're in the private sector, you are seeing the money coming that direction. The same patients that are coming here, you are referring them to a private pharmacies, but they cannot afford. So you have to think outside the box. If you are really patriotic Zimbabweans who care about the patients, you must turn this hospital into a money-making machine. Yes, they talk about user fees, but Zimbabweans are paying for private healthcare services. So there is a market already. It's not like we have to create it. Everyone here has got relatives, they are going to the private sector, which they can come here for a cheaper rate at a good quality. Your private sector, which you mentioned, if the policies have to be changed, let them be changed so that you can compete. You are the obvious most popular institution in the country. You must show leadership. By the time we get to Parrenia, to Mpilo and others, they are following your leadership. Is there a sense of leadership, especially in terms of vision and innovation? I don't see it. And I'm challenging you, the acting chief medical officer, I'm challenging you. That you should not just be the one who came and occupied the seat for 5 years. While 3 of those years acting, then the other 2 you retire. No, you must leave a legacy. You must leave what? A legacy. This hospital is clearly having opportunities for change and for growth. And there's a committee who are available to support you. And I'm sure the ministry, you have a privileged position. Last time we were here, your chief medical officer, Dr. Aspect Maunganitsi, was also talking about the ministry. Tagati. Now he is the permanent secretary. All of you are his colleagues. So Chawana Janeham, Dr. Maunganitsi should start with you guys. As the primary institution for healthcare in this country, Parrenia Thomas showed the leadership. So I'm challenging you. We don't have time, but I'm not happy with what is there, and I'm challenging you. Take advantage of proximity. In English, you say proximity creates opportunity. You have got Dr. Mangani on WhatsApp. You have to take advantage of your colleague. You are the one who was crying where you were. Now he's the PEMSEC. So we need innovation. We need new vision. We need leadership. We need leadership role modeling from you. Because we can't hear you as Paranyata crying. By the time we get to Wange, you are the ones who should show leadership. So you can't be crying. You are the most privileged hospital in the public healthcare system of this country. By far, we heard your report, all these services that are like Great Zimbabwe. No, you have to bring them to life. And it's your responsibility to create that new legacy. So we don't have time, but I hope this Chambok is going to be enough for you to jack you up, and then you wake up. And if you think you are struggling, you can even come privately. Some of us who are jacked up, we can support you privately and support you. Thank you so much. We need people to live. Parrenia to show leadership. Everyone else in the country will follow your good example. But right now, where you are crying, Minister Tagatichi, we submitted an invoice 2 years ago. This is not leadership. This is just being a manager. You have to be a visionary to say, what can I do? The ministry, I gave them the invoice 3 years ago. Even the prices have changed. What can I do as the one who is in charge? People are dying every day. Show leadership. We will follow your leadership, we will support you. We are available, and sometimes I just want to cry because why should Zimbabweans continue to go to South Africa, to India, where they pay much more, when they can come to Parrenia to Mpilo? It's your responsibility. The market is there. If I ask anyone in this room, this year from January, have you not gone to the private sector? Almost everyone will be saying this. The market is there. So let's change the laws, let's change the policies, let's adapt. Let's do benchmarking visits. You can invite committee members. They are very jacked up. They can go with you and see what's happening in other countries. Private healthcare is competing now with public healthcare in other countries. So let's have that happening in Zimbabwe. We are available for benchmarking visits. You should be available also. Thank you so much. Because of time,